Now, in the fourth section of our lecture topic, now we will talk about the genital tract injuries that are caused by direct trauma and foreign bodies. In this, we will talk about what are the effects of the direct trauma and foreign bodies on the genital tract and how these injuries caused by these two, like by the trauma and foreign bodies, how they can be managed. The direct trauma, if there is a direct trauma to the genital tract by falling on any sharp or pointed object, if you see in this diagram, there is swelling as a result of trauma or injury, and there is disfigured muscles and structure is all swollen, and there is blood and hemorrhage also. So direct trauma can be due to fall on the pointed sharp object. Usually there is bruising of the vulva and there is vulval hematoma. This is the hematoma collection of the blood, vulval hematoma. There is fracture of the pelvis, injuries to pelvic viscera like bladder, rectum, apart from vagina. So if there is fracture of the pelvic bone, usually any structure which is present in that area that can be damaged also, like bladder or the rectum. The management is assessment of the general condition and the nature and extent of the injuries, scooping of the blood clot after giving an incision, secure hemostasis, and obliteration of the dead space by interrupted mattress sutures. So this is all important. First, we should assess the injury in detail, and then if there is any hematoma, the removal of the blood clots by incision, and then stop the blood, and obliteration of by interrupted sutures. Sutures are given interrupted mattress suture to for hemostasis. Laparotomy. Laparotomy is opening of the abdomen. Exploratory laparotomy is usually performed to check what is the extent of the damage or the injuries. Foreign bodies. Various types of foreign body may be placed in the vagina or uterus and retained for a prolonged period, are often unnoticed by the patient. So sometimes foreign bodies are present and they are unnoticed by the patient until some conditions or complications are caused by them. In the vagina, we have foreign bodies like coins and toys, menstrual tampon or diaphragm, cervical cap or condoms, articles used to procure abortion, pads, swabs, dressing, and forgotten pessary. In the uterus, we have foreign bodies like intrauterine device or old gauze bag, articles used to procure abortion. Sometimes even during the surgical procedures, when laparotomies are performed or hysterectomies are performed, usually a gauze piece can remain inside the abdomen. So, and then sometimes coins and toys are placed into the vagina, and if there is a forgotten pessary, all these are considered as foreign bodies in the vagina and uterus. These are the examples of the foreign bodies. We have toys and pins, and then condoms and cervical cap, different things. Effects and management. Infection. Infection is common as a result of any injury or as a result of foreign bodies present in rubber goods, foreign bodies, swabs, or gauze packs. Pessary may produce vesico-vaginal fistula and may be a precursor of vaginal carcinoma also. If there is prolonged retention of intrauterine device, it can lead to heavy bleeding, irregular bleeding also. Management, once diagnosed, should be removed. So once the foreign body is diagnosed, the only management, it should be removed. So that was all about the foreign bodies and the direct injuries to the genital tract and how they can be managed. Thank you for watching sqadia.com.